Good morning, everyone. We'll start our presentation on low academic performance in school children. Let me thank all of you for taking your precious time and coming today morning. And we'll divide the presentation into 4 parts, starting with introduction, factors for low academic performance, how parents, teachers, school counselors, and we as mental health professionals can help, and about the life skills training program. So let's look at what is this low academic performance is all about. For the child's healthy development and growth, and also for the national human resource development, academic performance is a vital part of child's life. School-going children are the main area of concern today in our presentation, even though most of it applies to other children or older group as well. So the main reason why we have chosen this aspect, because the academic performance at the school level is the basis for the child's future performance, career performance, and the foundation of their career life. When do we call low academic performance? When there is a failure of an academic grade an year where the child scores below 50% and fails in 5 out of 6 subjects, we consider it as a grade failure and grade retention. Often the reasons or the factors of this low academic performance or scholastic decline are not the intelligence factors, but most of the research shows that it is the psychological and the health factors are being the forefront for this particular performance, low performance in children. So we'll go into details of each of the factors. Psychological factors, I'll cover it more details. Let's cover the social, health, and school factors first. Social factors were parental disharmony and single parenting. When I say single parenting, I don't mean that it's only the parents who are separated, or it also works with parents with the present scenarios where both the parents work in 2 different places, 2 different cities, sometimes in 2 different countries as well, where the kids are the sole responsibility of a single parent. Often the mother is one of the important social factor, comes under the single parenting. The other social factors that include the other social factors could be poverty, shifting of the jobs of the parents, frequent changing of the schools, thinking that a better school or a different school can make a difference, and factors like transitional periods where the children are changing from one school to one stage to the other, like elementary school to the middle school, where usually the decline continues based on their adjustment levels. So these are some of the social factors. We are not going to concentrate much on these aspects. I'll cover them in the life skills training program. The second aspect, the second important factors are the health factors, especially the factors related to hearing impairment and visual impairment, Often children having refractory issues, having squint issues where the child is unable to copy from the board and child is unable to express what they have learned. So all these factors come under visual. Hearing where there are infections of the ears, bone conduction and problems related to other hearing loss or impaired hearing loss. Medical issues like epilepsy or fits in children and medical problems like diabetes or any other conditions where the child has to be on medication. So these are some of the important health factors that come in the way of child's school performance. Coming to the school factors. So the attitude that the parent as well as the child has towards the school curriculum and the school environment, the relation with the teacher. So attachment with the teacher is always considered as one of the important variables in better school performance for the children, and importance given to the extracurricular activities also play an important role under school factors. And coming to the psychological aspects, we'll consider them as a little more detailed since we are going to look at the interventions mainly focused on the psychological factors. So psychological factors are basically looked at from some important aspects such as depression in children. We'll cover each of them a little more detailed. Anxiety in children, anxiety, fears, and a bit of family relationships also come under psychological factors, not but the least the learning disability problem. So we look at each of them a little more detailed. Depression. Most often depression is undetected and not noticed by the school environment or even for that matter for the parents, because when a child is going through a depression, generally, they don't show it like an adult. The way that they express depression is different. They show low energy levels because they are constantly hit by these negative thoughts, unwilling to attend the school, not able to complete the school task or homework assignments, and often they have problems in sleeping and eating, which come under depression. So it is important to recognize these signs at the earliest so that it can be an immediate step towards treatment can be taken. Treatment does not always mean that you have to go for a professional. Sometimes the parents can look into details of what is making the child upset, what are the factors coming in the way, by keeping a check on day-to-day basis what's happening in the child's routine, spending a little quality time pre and especially the post-school hours considered to be very important in knowing the child's state of mind. So any fight or any disagreement or anything, bullying or any teasing that the child has gone through during the school period or during the out of school activities, one should keep a track of what's happening in their environments. Since depression is one of the major cause, often even in very bright children, depression is often exhibited or expressed or often understood as having behavioral issues or being lazy or not being interested in going to school, or sometimes children they might show these kind of behaviors where they might get back to the childhood very young, regressive kind of behaviors like bedwetting, nail biting, All these are signs of initial stages of depression and emotional imbalance. So often for the school decline, depression has been time and again. The research shows that the depression is one of the major cause for the school failure. So generally, when there is a low academic performance in children, and then over a period of time it hits the child's confidence levels, they show very less interest to work towards the weak areas, and hence they might end up being school dropouts. So it is an important factor to consider and then recognize it and treat at the earliest. Coming to the anxiety and fear factors. So it can be a fear related to school, or anxiety related to writing exams or completing assignments, or not able to complete the homework assignments, or just being away from parents itself. So again, anxiety can be expressed in acting out or freezing out or crying behaviors, and most often children lack the emotional language to express what is making them anxious or what is making them fearful, and often it is being misunderstood as something that the child is just trying to do something that is to catch the attention of a parent, but child always have their own reasons why they behave in a certain way. So there is no reason why a child has to be dishonest, even if the child is in a classroom setting like that, even if a child is not able to concentrate, or the child is trying to disturb other kids. Everything has its own reason. Maybe the child did not have enough expression at home, maybe the child did not have enough sleep, or there can be related to factors related to not wanting to attend school because of the bullying or teasing, which the child often does not express to the adult or a teacher, and then it ends up into being one of the factor where the child might just refuse to go to school and try to be in the safety of the home. So this is about the anxiety and fears. Coming to the family relationships. So a major, a very important aspect of how as a family the child position in a family plays a very major role for school going children. So where even to some extent the social factors also come up in the family relational aspects, where the relationship between parents, constant fights between parents, often making the child as a way of sometimes one of the parent might become more closer to the child, doing an adult talk, sharing their problems with the child, and often might become a burden for the child because the child does not know how to deal with that, and sometimes they may have to do a lot of damage control, like when there is alcohol problems in the family where the child does not sleep because of the constant high noise level, and sometimes the child may be forced to take care of the sibling where which the child is not prepared to. All these factors will affect. And sometimes there's another important aspect to this, where when the parent or the parents feel sensitive that the child is understanding their discord issues or friction, sometimes the parents leave the child in care centers or with some relatives, will often pose more risk factors like getting into neglect, or the more often factor, well-known undeniable factor of child abuse. When I say child abuse, it's not about just child abuse of sexual kind. The child abuse can be a verbal abuse in terms of physical abuse, like punishment, showing the anger on an adult, towards like a transference towards the child, all these factors will affect the child's school performance. The child need not be, someone having low academic or low IQ issues, but even the so-called very bright children can equally get affected with these emotional aspects in the family relationships. Coming to LD, learning disabilities. So most often, even trained school counselors and teachers are unaware what is this learning disability and how to recognize. So to look at a little more details into what is a learning disability, we call it SLD, specific learning disability. Even though a child has an average IQ or sometimes above average IQ, children sometimes have this particular problem where child's basic skills, there are 5 basic skills: reading ability, comprehension ability, writing ability such as copying and self-expression, and numerical ability as well as spelling ability. These are the 5 important academic skills that are very important in the till 5th standard grade, till 5th grade, where the foundation of the further academics or the further skills of the child are built on. So often the child might show or 1 or 2, like in conditions like dyslexia, where there is a reading disability with the child, where the child shows very early signs of unable to kind of recognize the letters, getting confused with the similar letters, and often it is expressed as they move on to the higher grades. It is often expressed in terms of unable to read simple words, 2-letter, 3-letter words, and sentences, and moving on further. So often these learning disabilities are again misconceived to be as behavior problems, because often the children might show disturbances in terms of low attendance, unable to attend to the class when the teacher is explaining a concept, because of their factor in writing difficulties, and all these factors are very important to be taken care. So apart from these important factors, there can be some extreme conditions where teenage pregnancies is one of the possible factor affecting the school-going children, maybe at a high school level, and experimentation with the getting into risk behaviors like smoking, drug addiction, these kind of behaviors. So all these are some of the factors that are considered to be affecting the performance of school-going children. Coming to the third aspect, interventions. Interventions as in how we can help these children, whether it's the role of a parent or a teacher or counselor or we as mental health professionals. The early detection is the rule or the principle for the immediate response and able to help the child at the earliest. So coming in specific to the role of parents, what role a parent should be playing when they recognize these early signs of low performance in their children. So taking interest in their day-to-day school life is something that one has to follow on a daily basis as a routine, and reducing the homework schedule or being a little relaxed about the homework schedule, making it an exercise of learning skills rather than making it somehow completing the homework. maintaining a homely environment in terms of emotionally balanced environment at home. Any small sign of disturbance that they observe, whether it is in their sleeping pattern or eating pattern or any behavioral pattern, has to be immediately taken seriously and looked for an immediate resolution towards helping the child. And participating in the school activities, whether it is extracurricular, sports or after school activities, being with the child and available to the child. When I say available to the child, it's not about just a physical presence, that the child emotionally feel comfortable to share when the child has gone through something upsetting or something not going well. And if you only end up saying that you should have not done like this, not done like that, then child over a period of time stop sharing that. They only think that you are only telling them and not understanding them. So being with the child emotionally is a very important aspect. And children often getting into comparison with the sibling or children who are getting higher grades has to be something that a parent should withhold, which comes very naturally, especially if there is a sibling at home. And these are some of the important aspects: early recognition and any changes in the regular routine or any behavioral changes need to be immediately taken and worked out in collaboration with the school counselor or different environments where the child is interacting or working with. Coming to the role of a teacher. So it is easy to get carried away that with the bright children, because they are bright anyway, and then they will respond. So the most of the focus should happen on these children who are not being active in the class and trying to be non-participative in the class. Early recognition by the teachers, by regular attendance of these workshops that are meant for enhancing their skills, not only related to the teaching skills but also related to identifying the various factors that will help the children to perform better. Often the research shows that the attachment that a student has with the teacher is one of the motivating factors for them to perform better. So other than other aspects that the teacher should also look into, that the student identifying the strengths of the student and encouraging the student towards the strength, rather than only focusing on what the child is not good at, plays an important role. And encouraging the students to participate in other activities that happen at school, be it sports or drama or theatre, whatever, music, art activities, where they can be encouraged towards their stronger areas. So this about briefly about what a teacher can do. Coming to the school counselors. So school counselors play a very vital role in the identification as well as intervention process. It is a must that every school should have a trained school counselor along with a special educator. So often teachers the regular teachers are not trained with their skills of how to handle these children with learning disabilities. So the children with learning disabilities, once they have identified in which area that they need extra help, be it numerical ability or reading ability or writing or spelling abilities, they need to be having a specially designed, individually tailored academic program. So a special educator is trained for that particular area where they can help these children. Along with the regular school and class attendance, a little extra help for the children should come from these sources. A school counselor need to be aware of what are all the factors, classroom observation, attending or sitting with the class when the class is going on, and able to identify children who require this extra help and immediately connecting with the parents and school authorities, so that early help can be, early help can be, they can work through how we can help the children at the earliest, before the child completely loses interest in coming to the school or getting up into other emotional aspects, other emotional disturbance. So, coming to the mental health professionals, when I say mental health professionals, the role that is played by clinical psychologists and the psychiatrists. Sometimes the children having issues like attention deficit disorder and some of the conditions where the child are restless, unable to sit quietly, because the classroom always needs an environment of self-control and not disturbing other kids in order to understand what is being explained in the classroom. So often the children with attention deficit problems have this difficulty that they can't sit quietly, and often understood as that they are disturbing other kids or being very restless, and all these has to be immediately brought to the notice, where they need the interventions of mental health professionals, where a set of assessments, SLD assessments, assessments related to ADHD, and all these assessments will give us whether they need a little bit of medical help, or sometimes the parental counseling and a modification in the environment at home, and little help from the teacher, from the school, can help them at the earliest to deal with these initial disturbances that the children show. Often it is proved that the emotional as well as the psychological as well as the health reasons are the factors holding a major concern than the other two factors. So coming to the life skills training program, before I look into the details of what is the life skills training program, I would like to discuss about few important areas of concern. So life skills, when we say life skills training program, generally we look at assertive training or social skills training, or working on study habits of the children, or how to improve their problem solving ability, these kind of things. But we at our center, the life skills program is being designed from a different perspective. So we are looking at 6 important aspects that will help them at the early recognition and help the children to become a little more stronger from an emotional aspect. I'll cover each aspect. The first aspect is the social skills training. When we talk about social skills training, we are looking at children who are a little shy and socially inhibited, less expressive verbally. So most often we look at it as a weakness of the child, but it is a normal temperament. Like some children are extrovert by temperament, some children are introvert like any adult. But then in social skills training, the focus is more in terms of how a child who is less verbally expressive can focus on becoming a very good listener, It's not necessary that a good speaker always will be a good listener, but kids who are less verbally expressive can be very good listeners. We can train them to be good listeners. We can help them to be less anxious in social situations and help them to identify their skills, their strengths, and then focus on improving their self-concept rather than looking at it as a weakness. So we at our center focus on this particular module where different social skills such as how to be assertive, how to take turns, and how to be a good listener, what are the how to respect when another person interacting with another person, be it their own peers or an adult. And these kind of skills are being taught to the children. We are focusing mainly on younger group of 8 to 13 years. The reason for choosing this age group is mainly because they are more flexible and malleable, and at an early stage they are working on their coping mechanisms. It will give them much more emotionally healthy individuals as adults. So that is a concern that is the idea where we have chosen this younger age group. So mainly the social skills training is the first module where we focus on improving the listening skills of the child, social comfort, and identifying their strengths and working with a positive self-confidence. Coming to the second area is that we have chosen is the teasing and bullying. So teasing and bullying happens everywhere. Not only at school, even in other areas, sometimes even at home, without our conscious intention. We often in a very jovial way, we might try to comment on the child's looks or appearance or the complexion, which is taken a little more seriously and in a hurtful way. There is a serious side of the bullying where even the child might become close to attending the school, where they are afraid of bullying at school or bullying at other places with the kids, peers, and often the shy children are one of the target areas of bullying. So bullying can lead to depression, bullying can lead to academic issues, bullying can lead to fear and anxiety and a whole lot of emotional disturbance. So it's important to address this aspect of bullying. There are two components here where the children are trained in how to face the bullying, how to face the person who is bullying them, and also be a supporting network for other children who are bullied. So the main focus is on these two areas, that the child should know how to face it as well as how to be a support system for other kids who are being bullied, and try to inform the adult at the earliest so that a serious action or an immediate action is taken before much damage is done. So coming to the third aspect, a very important aspect is the safety concerns of the children. So all that we hear day in and day out is about how children are being abused, and as young as months, babies in different ways are being victims of parental discord, and where the children often unaware that what's happening to them, and it is important that the child is aware what is a safe touch, what is an unsafe touch, who is a safe adult and who is not a safe adult. So it is important to prepare the young children, understand these concepts and how to identify the risky environments and inform an adult at the earliest so that much damage is being, before much damage can be done, they can be prevented from these kind of concerns where often they leave a long-term marks on the child's temperament. So coming to the fourth aspect, the impulse control or anger control. So often children are being told that it is not good to be angry, but anger is an emotion that we all go through irrespective of a child or as an adult. It is important that we all get angry, that the child need to understand or able to understand it's all right to be angry, but the way that you express anger should not be hurting the other person. When it is hurting the other person or themselves is where the management or the control is required. So here in this particular module, children are taught about how to identify different emotions. Emotions are often universal, irrespective of whatever, whichever place or whatever, wherever that the child is living. So it is important that, or it is, when I say universal, I mean that emotions are like happy emotions or feeling sad or anger are the emotions that are understood as something that we all go through and then recognized, and they can be recognized by looking at our facial expressions. So training these children how to identify especially the troubled emotions. The focus is more on identifying the troubled emotions such as anger, sadness, upset, and how to express these emotions verbally or in different ways to a safe adult so that it is not becoming a maladaptive pattern for the child. When these negative emotions are given enough expression, it helps the child to grow as more accepting that we all go through these negative emotions, and then it is important that we need to communicate so that they can get that support that is required to handle these emotions. So coming to the fifth aspect, I have covered the fifth and the fourth and the fifth in terms of identifying the emotions, negative emotions, and also the anger management specifically, which covers the fourth and fifth aspects. Coming to the important and the last module, the sixth module is about forming regular habits and healthy eating and sleeping habits, study habits, healthy eating and sleeping habits in children, maintaining a work structure in terms of a kind of activity schedule on a school day, routine day and weekends by including the extracurricular activities. So where there is place for fun activities, at least one or two activities that the child does on a daily basis that are pleasant and of the interest of the child can actually keep up the psychological health of the child, be it arts or be it drawing or any sport or anything where the child can build their self-confidence. So the main focus on this module is been on importance of regular sleeping, healthy sleeping and healthy food habits and healthy study habits, maintaining a structured routine and how to develop a timetable for them so that they are able to plan in a way, able to be focused towards what they can, how they can utilize their time in a constructive way. So we conduct this life skills program all through the years in 4 to 5 batches. Generally each batch is restricted to 10 students, and it's a group training program involving an artist and a music therapist and clinical psychologist. The basic mode of training, because we can't present too much theory, like how I am talking to you, I cannot talk to a young child. So I need to use a different method or medium of conveying these concepts to the children. So we actively use methods of skits, story narration, art therapy, and demonstrations, role plays, and various enacting of various scenarios, sometimes involving the kids, sometimes using young models as a way of imparting these concepts. So the life skills training is designed in such a way where the child can attend it like a weekend program. Generally we are looking at a time where Saturdays and Sundays, 1.5 hours, 10 a.m. to 11:30. So it's a 7 weeks program where the 6 modules, each module is covered in each week, Saturday and Sunday. And 7th week we conduct a parental group session of the kids who are in that particular batch. So we can't always, this brief training of exposing the children to various important life skills is not going to bring in a life-changing difference, but then it is the maintenance of them where the parents are involved as a group session and giving them the feedback as to how they can sustain these life skills by making modifications in the home environment and looking at how they can help the children to continue to grow as emotionally healthy individuals. So I hope you all be able to appreciate what we are trying to do. This is our small way of looking at how we can help the young children by working through these life skills program.